So where the myofascial lines are really looking at the organization and the interrelationship between these anatomy points throughout the body. The question that I get asked the most or most often is, well, what does this mean for force transmission? What does this mean for our athletes and for, sprinting and expression of force? And I think that the best way to start this is to understand that those relationships, those anatomical relationships, are going to be largely determining for the expression of force. So in other words, if we start here by looking at the position of the hip, which in this instance is the proximal component, the amount of trunk bend that we have is going to change the firing pattern or the rate for the thigh muscles. So if we have, whether we're looking at this from the myofascial line perspective or just from the, conventional agonist-antagonist coupling perspective, our trunk position is going to determine how our thigh is going to function here. In addition to that, we're going to see a change in the sarcomere length, which is going to change the mechanical relationships. So this is going to have a major influence on the firing sequence and potentially even the firing rate. Whereas, again, if I have an athlete who, for instance, has some limitations or let's just say some impingement at the hip, a deeper trunk angle is probably going to be a little bit more uncomfortable or less favorable for them. So I would want to position them to be a little bit more upright and take some of that stress off of the hip. Conversely to that, if we have an athlete who spends more time in that forward flex position, this is probably going to be more advantageous for them. So, depending on what our outcome goals are, what we're trying to get out of this, we can play with that trunk position to optimize or emphasize certain portions of the thigh group. When we think about the change in angles, we're then going to have some degree of change in rotation. So I touched on it quickly earlier in the slides here, but make no mistake about it. The predominant mechanism for force expression is going to be the myotendinous junctions and the longitudinal force summation. However, the myofascial force expansions and these intermuscular coordination concepts are going to really be prevalent for the distribution and the dispersions of force. So if this were a dynamic action here where he were doing kind of a single leg hop from this position, the Achilles and the tendinous junctions at the hamstrings, that is what would produce his foot coming off the ground. When we think about the return back down to the ground, I think that there's more responsibility on the intermuscular coordination and the myofascial junctions to be able to disperse and distribute this force. And if we think about the calf is a good example of this too, and if we're thinking about this in relation to knee health or ACL health, it's been said that the calf muscles act almost as like airbags for dispersing force experienced at the knee. So for my sake, that goes to the intermuscular coordination of the medial lateral gastroc heads and the soleus, and even to include down at that Achilles junction, where if we don't have a good ability to disperse or distribute force across those structures, then it's just going to continue to put repetitive strain down on the Achilles, and eventually that's going to not only deteriorate the Achilles tendon itself, but then also put the foot in jeopardy as well, because if the Achilles is not doing what it's supposed to do, then we start to experience more direct force excursion at the metatarsals. So this is a great example of this interconnectedness and of these multiple systems that are all doing certain things to help produce collective outcomes. The last note here is similar to the degree of rotation or angle of inclination at the trunk or the hip. The base of support and the position of the foot is going to be critically important for virtually anything, at least dynamic in my mind. What we'll see often with this is this heel will want to pull in towards the midline, and I think that has a combination of things, but something to do with the inability to pressurize or have compliance across the foot. In some cases, it could also be due to a weakness or deficiency at the medial arch, but in other words, the degree of rotation or the position of the heel here is going to determine what point across the foot are we pressurizing through, and then what that kinetic sequencing or integration is up the lower leg, and then again from there up to the thigh. So the degree of tibial rotation is going to be something that's wildly important for athletes, especially. But also, I would say this is something that I see quite often with injury restoration is these little compensations down at the foot and the ankle, and it's really done to try to bypass certain structures of the leg or the knee.